Productive Dentist Academy podcast network.
20, 30, 40 grand under. And just, yeah, I was drowning. I think I used that term with Sarah and Angela. Like, I feel like I'm drowning and I don't know what to do. I don't know if I want to keep doing this. Like, there's probably something I can do. It's probably not going to be as profitable, but I mean, what I'm doing right now is not profitable. So I might as well go figure out something else to do.
Welcome to Investment Grade Practices Podcast, where we believe private practice dentists deserve to get the lifestyle today while building an asset for tomorrow. Join your host, Victoria Peterson, to design the practice of your dreams and secure your financial independence. Let's get started.
Have you ever felt like you're the only one? You're the only one who's struggling in your practice, who's struggling with team issues, who's struggling with insurance. Well, I'm here to tell you that you're not. Hello, I'm Victoria Peterson. Welcome to the Investment Grade Practice Podcast. I am here with an incredible human being, Dr. Justin Villafane from the great state of Nebraska. Justin, welcome.
Hi, thanks for having me, Victoria. It's a pleasure.
You know, before we came on air, you were sharing a story of recently being at a conference, and you came back understanding that all dentists have a lot of things in common. Can you share that for me, please?
Sure. It was a pretty big implant conference, and so we're all there learning about implants and dentists. I used to be the young dentist at these things, and now I'm kind of like mid-range. Like, there's young dentists, and now there's like people older than me. Uh, but I mean, I heard people of all ages just in passing and conversations. Like, there's a lot of people that are frustrated with. I think it boils down probably to the business aspect of dentistry, of dealing with insurance and the headache of that, and patients like wanting the insurance to cover everything and for dentistry to be free and or cheap at least. And unfortunately it's not. And 6, 7 months ago when I started PDA, like, that probably would have freaked me out because I was struggling at that time. The practice wasn't in a good place. And I after hearing all these individuals kind of talk about it, I was just like, like, it is a very challenging environment right now. And there's several ways to go about it, but you just have to make yourself stand out. You got to up your game. You got to do things that, other people don't do, or if they do them, do it better. And so, I'm fortunate that I live in Lincoln, Nebraska. There's a lot of great dentists here in town and the surrounding area, like lots of great dentists. So it's not like the old days where, people stayed at an office even if they didn't like the dentist because there was nowhere else to go. Now, like, they can just go down the street and it's a great dentist. Like, I have friends on either side of me. And they're amazing. And, yeah, so it's one of those things where I think we're all just trying to figure it out. And, I do some implants, but I want to be able to do more, and refer out less. And, I mean, that's what I was kind of there to learn, but I also learned some of these older dentists are kind of dealing with the same thing I was, and they've been at it for a lot longer than me.
Thank you for that. I think the struggle is real and and it's only growing. You know, tariffs aren't helping, supply chain breaks aren't helping, virtual work is not helping, brick and mortar businesses. I mean, dentistry is a real people business, literally hands-on. You couldn't think of a more hands-on profession than the healing arts and medicine and dentistry, and so the pressures are different than they were before. You mentioned you came into coaching about 6 or 7 months ago. Just in a short period of time, where were you, and what did it feel like, and where are you now in kind of in the middle of this, and what does it feel like today?
So, I started PDA in June of last year, and we had just dropped like 50% of our network insurance plans,
Mm.
because I had been told by a consultant, like, that's what you do, and how to go about it, and that type of stuff. I had two full-time hygienists at the time, and long story short, obviously patients left, and one or both hygienists weren't busy anymore because I live in a pretty affluent area, so to speak. And so people, they just mainly need maintenance. And so if they can go to a great dentist down the street and get their teeth cleaned and it doesn't cost them anything, like, I don't blame them. And so I kind of, shot myself in the foot, so to speak, just by like,
At Productive Dentist Academy, we've helped thousands of private practice owners find the clarity inside their data and take control again, starting with a free 60-minute coaching session. Head over to investmentgradepractice.com right now before the next patient sits down to claim your free 60-minute coaching session. That's investmentgradepractice.com.
All right, we're dropping it and we're going to keep the two biggest ones and we'll be fine. Well, we weren't. And I mean, we got to a point where, I mean, it's just me and one hygienist and I have two assistants now. But I mean, we were down to, I mean, I was producing 50, 60K a month. Just with, there was nothing going on. I didn't know how to, treatment plan comprehensively, or I just wasn't. I was just in a real bad place. Like, I felt like I was letting my staff down. I felt like I was letting my family down. Thank God my wife is an amazing, amazing person and amazing businesswoman. And so thank God my family wasn't relying on me because I needed to get my stuff together. So, um, so I had contacted my friend down the street, who was also a dentist, and I knew that she had started an office from scratch and she'd used PDA. And just, she's an amazing, incredible person, great personality, and she's doing amazing. But she used PDA to kind of seed the ground and, advertise, hey, I'm going to be here. I'm opening this day. Like, very well thought out, well planned. And in my head, I'm like, I need to market. And honestly, like, I really didn't have any money to do it. And so, like, I took out basically the last loan I could, and I contacted PDA and talked to Sarah, and she was amazing, like, because she could have totally been like, hey, let's do this with this media campaign and these advertisings and these flyers and stuff. And I think it was her and Angela that got on a call with me, and they were like, I think after what you've told us, I think you'd benefit more from a coach than from advertising right now, because it sounds like you need to rework some stuff at the office. And they're absolutely right. My leadership wasn't good. It wasn't strong. It wasn't consistent. I was super stressed. And so all those things bleed through. You might be able to hide it from the patients, but I mean, your staff can feel it. And I wasn't enjoying it. And, I was just in a pretty bad place. And so, yeah, I got introduced to my coach, Kim, and, she was great. And she's like, don't worry, we're going to help you fix this and put some systems in place. And I mean, really, that's what it's about. It's about systems and communication, consistent communication. As with anything in all relationships, it usually boils down to communication. And if you're not doing that, like, it's either going to affect your business, your staff, your relationship, your marriage, everything. So, that's kind of how I came into PDA in June. And I think, like I said, I was not producing a lot. And just from, mainly patients of record, I just started talking to them about, like, I'd really fallen into that trap about, hey, this tooth is cracked, doesn't hurt, you don't have decay, and you haven't broken it. So insurance is going to pay for it. We're going to watch it, or there's no reason to bringing it up. And during this time, I was also listening to Dr. Baird and listening to his whole series of podcasts. And he's just like, no, that's not right. Like, tell the patients what you'd want. And I mean, he was 100% right. Like, your chances of needing endo or, losing the tooth go up exponentially if you break it or it becomes painful before you do the crown. And so I just started explaining that to my longtime patients. And I was very surprised I was a little afraid that they were going to think, oh, he wants to buy a new house, or, he must have a boat payment, because I've been coming here for 10 years and he's never.
Wait, do you need a boat in Lincoln, Nebraska?
Not at all. And I'm not a boat person. So no, not at all. So, I mean, there's people here that have boats. We got lakes, but yeah, nothing fancy out here.
Oh, that's
Um,
great.
but it was super well received. And to my surprise, it wasn't "Oh, you're just trying to get money out of me." They're just like, "All right, you showed it to me. We took pictures." I was like, "Makes sense. Let's just do it." And of course, having the conversation. Look, there's a good chance your insurance won't pay for this. Okay. We'll do everything we can. We'll go above and beyond in submitting PAs and integral pictures and a good narrative about the things we do. But at the end of the day, insurance companies like to deny things, and so I just want you to be aware. Best case they're going to pay this. Worst case you're probably going to have to pay this. And again, well received. And
You're having this conversation.
hmm,
You're having this conversation with the patient, or is
yeah, yeah, I was.
Oh, I wanna highlight that because, so many things about what you've said already, Justin, are so courageous. I don't know if you feel courageous, but, like, my heart is just, like, so big for you and your story. Um, and to sum it up, I'm putting the finishing touches on my investment grade practice book, the
Oh,
companion
cool.
to the podcast, and, you just illustrated 3 simple words that everything is founded on, and people that I send it out to, they go, "Yeah, what's this compassionate, preventative, comprehensive care? What's your real compelling why?" I said, "Well,
Yep.
that's how you showed up. I'm compassionate for my patient. Not what would insurance cover, what would I do in my own mouth? What do I know as a clinician about what's down the road for this patient, and do I have compassion for their future pain? Or am I gonna bypass it today because, well, teeth break, I'm sorry for you, right? So you had compassion about the future potential, and then you had the courage to be preventative. And I have to tell you, I became a hygienist before scaling and root planing was even a procedure. So it's been a minute. It's been a minute. And I can remember dentists saying, I don't want you to do like all the new fluorides were coming in, people were accepting. I don't want you doing fluorides and preventing decay. I wanna do molasses trays and give them
Oh my god.
like, we've come a long way. So, as someone who started out as a preventative specialist, to hear you, dentists, understand that it's not just perio that we're preventing, it's caries that we're preventing, it's breaking teeth, it's heart attacks, it's stroke, it's the whole oral systemic realm, that is a much bigger view of prevention, and you demonstrated that with this patient. And then comprehensive care. I'm so glad you referenced back to Bruce because he would not know how to not be comprehensive.
Mhm.
And I remember, we went on quite a few trips together to the Dominican Republic, and, you think about missionary dentistry, and it's just pulling teeth and sending them on the way, and he's like, "This is ridiculous. We have a clinic here. Why isn't it not open while we're here? Why are we waiting for the Americans to come? What does it take to fund this clinic? They need cleanings, they need fillings, they need childcare," and we found out, honestly, it took $2,000 a year to place a dentist there 1 day a week.
Oh
So
my gosh.
so let's open it up 3 days a week, and let's give this community real health care. So we hired some dentists, and I mean, the Dominican director, we funded it and said, "Go find people who wanna work here." So now we can't go to that clinic anymore because nobody needs missionary dentistry.
Did too good.
Right? And so I feel like that's what you're doing. It was a bold move. Number 1, I will put a shameless plug here. We've got a new program. You may not even know this. We've got a new program. We're starting live events again in September. So September 10th and 11th, we're gonna be in Denver, Colorado, in a brand new program called Unrestricted: Ending Your PPO Dependence. Because there's the, "I hate insurance, I'm dropping half of them, and we'll see if the elevator stops before we hit the basement."
Yeah.
Yeah, and then there's the other way that, in the beginning, doctors would go, "I don't wanna wait 12 to 18 months," but think about you're on the right path now. Let's get our staff in line. Let's do comprehensive care. Let's have courageous conversations with our patients. Let's put new systems in place that are built for fee for service. Let's market for more fee for service or insurance adjunctive, not primary. Get all your ducks in a row for the model. Put membership plans in place where people are coming for a different reason than the insurance. Then your patient base might be 3,000 patients and 1,000 are insurance. You can convert because you still have 2,000 patients of record.
Mhm.
So that's what that program's gonna be all about. So it's all the PDA principles that you've talked about and you love with diagnostics and marketing and communication, but helping doctors who might be new to PDA understand that there's a system for it before you make that courageous leap. And so I'm happy you found us. What does it look like just 6 months later? I know we haven't fixed all the problems of the world yet, but how's it going?
I mean, like I said, it wasn't a good scene around here. I was pretty burned out. And I guess I was always kinda, "All right, well, this isn't, making me more productive. What about this thing? What about Botox? What about this? What about that?" And I already do really good, like, services that nobody else does around here, and I have more experience in it, and instead of focusing on that, I was just I'm pretty sure I have undiagnosed ADHD and OCD, like, pretty
Everybody in dentistry does.
absolutely, and my wife too, so our 2 boys are just bouncing off the walls. But it was like that, and I think as I've gotten older, it's gotten worse. I'm like, "What?" Just that. But I think I had done some sort of projections for 2005 and, like, a target for every month, and, up until June, so ending in May, um, that's 6 months, 5 months, and, I think I hit my target that we were going for production, maybe half of those months,
Mm.
and then sometimes not even close, like, 20, 30, 40 grand under, and just yeah, I was just, I was drowning. I think I used that term with Sarah and Angela, like, I feel like I'm drowning, and I don't know what to do. I don't know if I wanna keep doing this, like, there's probably something I can do. It's probably not gonna be as profitable, but, I mean, what I'm doing right now is not profitable, so I might as well go figure out something else to do, and they were so, caring, and they kinda took me under their wing, and, I kinda told you, like, instead of doing advertising, which is what Sarah does, she's like, "I gotta turn you over to our coaches, and then we'll get to advertising, but we gotta fix some stuff first." And she was 100% right, like, all the things going on in my office that I blamed on, staff and, the things going on and the clearinghouse, getting hacked and, it it really boiled down to me, like, almost all the problems in our practice were because of me not being a good leader, me not, diagnosing things properly, me not charging for things, like, I'm a really nice guy, I like to give stuff away, and I shouldn't, so, like, when I'm doing a highly complicated procedure, like, I need to charge for it, but there's sometimes I'm just like, I don't want to, and you can kind of fall into a habit of just like, "Oh, I'm just gonna do this pulp cap, won't charge them," or "I'm gonna do this gingivectomy, not gonna charge them." And that's something that Dr. Baird harped on. He's just like, "You are doing the service. Like, you are one of the best at what you do. You have to charge for your services. Everybody else does. Like, why are you giving everybody a discount?" And so, I think the first month, we overshot whatever our goal was by like 15,000. Just no advertising, just diagnosing. Like, "Hey, this tooth is cracked. Here's a picture of it. We should fix it before it breaks." Most of my patients, that's all it took. They're like, "Okay, yeah, I trust you. I've been coming here forever." So, um, and then by month 3, um, I think we'd upped our production 30%. But I mean, you gotta realize where I started from. So, but it's all PDA and showing me how to do systems and how to communicate with my staff. So we are on the same page. So patients aren't hearing different things. And then they don't trust you. They're like, "Okay, you're talking about this crown on all of a sudden. Like nobody said anything about this. What's going on?" And it makes such a difference if your hygienist takes just a picture and puts it up on the screen and says, "This tooth is cracked and it's gonna break at some point. The doctor's probably gonna want to talk to you about it." And they get that. Like they let that sit and ruminate for a little bit. And then if I come in and I'm like, "Oh, you're breaking stuff, man. What's going on?" Don't get me started on everybody that's on like, anti-anxiety meds and SSRIs. Like I don't have a problem with decay so much as I have a problem with like bruxism, attrition, like just mechanical fracture. And, most of the time if there's decay on a crown prep, it's because they cracked it, didn't do the crown for a while, and it started leaking internally, and then they got decay. And then I'm like, hey, we got to do this now. And, you know,
Wow.
that's just kind of the area that I'm practicing it. And,
That's
but it's,
crazy. I'm gonna come back to that in just a second. So I'm gonna wrap up this session. So let's see, this is March. So it's been 9 months. And you started out somewhere around 50,000 a month, underproducing, can't pay your bills, stressed out, thinking you needed marketing. And hats off to the amazing team at Phoenix Dental Agency because I have told them we don't sell brochures, we don't sell websites, we sell solutions, and we may not be the right solution. So thank you for reflecting that our ad agency really takes that to heart
of
because
course.
they know that they can get the people knocking on your door, but if what's behind that door isn't functioning, you get 0 ROI, then you think marketing doesn't work, you get pissed off at us, and then you stop marketing because marketing doesn't work. So, it's a
100%.
vicious cycle. Where are you today? Just, ballpark of, productivity just so we know what's possible.
Um, I mean, I was producing probably a little more than the average when I started, probably 400, 450 an hour. Um, I didn't even know what that was or what that meant. But Kim broke it down. And then just that first month, I think I was, 550, 650 just from talking to patients that were already in the chair. Um, and now like, we got the segmented scheduling for production. I did purchase a milling unit recently, and so that's kind of thrown a wrench into our scheduling for production because it takes me longer now.
Sure.
But we've been doing it for 2 weeks. I've cut it down, like, how long it takes me, and it'll be even better. Right now, I'm kinda doing mostly, the design because I wanna kinda get my hands on it and mark the margin and make sure it's okay. But I'm gonna start turning my assistants loose and, check in, but that's gonna free me up to get back to what I was doing before we got the milling unit, which is kind of a bottleneck right now. But
Yeah.
if they can kinda handle all the heavy lifting on that crown and get it milling and I can be doing something else with my other assistant, and then, I mean, we're back cooking with gasoline again. So, um, I think, in February, we produced a little over 115,000, and we're projected to do more than that this month, longer month. But on that same note, Jody said, "Hey, you guys upped your fees at the beginning of the year. It's easier for you to produce more, but you're writing a lot off because we still have some PPOs." And so that's something we have to wrap our mind around. And it's just my market is a very, very heavy. Everybody gets their insurance through their employer, so everybody's got their PPO. They just want their free cleanings. They don't want to get off their cheap dental insurance.
Yeah, yeah, I get that, I get that. Well, congratulations. This is a reflection of you putting in the work. We often say that the practice can only grow to the maturity of the leader. And
Yeah.
you really kind of looked in the mirror. I think you looked gently at first, and then you turned on all the lights and said, "All right, let's just face it head on." And encouragement to anybody who's listening to this podcast, it's really not scary to turn the lights on. The scary part is just flipping the switch. Usually what you're gonna find is a wonderful, compassionate, amazing human being staring back at yourself, but you haven't been taught the systems. And 9 out of 10, I've been a consultant for 30 years. I've got a lot of friends who are consultants, and I can tell you the primary framework goes something like this: volume times value equals collections or production, right? And
Mhm.
the emphasis is on volume. Fill the schedule, reactivate your patients, reappoint at certain rates. It's all a rate piece. And so that's really good in the beginning, like your friend down the street who scratch started. Volume is your friend in the beginning. But once you get 1,200 patients a record, 1,500, then you've got challenges of abundance. Like, it's me and two hygienists. I don't want three hygienists. How do I take care of all these patients? And if you stay in that model too long, you're just juggling out healthy patients. because we reappoint the ones that we like. That's what I did as a hygienist. I don't like Bob. He's a pain to work on. I'm not gonna reappoint him. I I like Mary. She has no tartar, she doesn't bleed, and she's pleasant to talk to. So your schedule gets filled up with really nice people who have no needs. And so our high need patients are put on the back burner. Our heaviest PPO write-off patients who are compliant come in, and then you're trapped. That sounds like the place you were at. And it was courageous, it was bold. Your elevator did stop somewhere around the 2nd or 3rd floor, which was great, but now you're playing the value game. I wanna have Jody go back and look and see where was your per patient value when you started, and where's your per patient value today? So if you haven't checked with her on that, check that because you flipped the narrative. The volume times value equals results is still there. You're just putting more quality of care, quality of value, comprehensiveness, prevention, those pieces. So now you can see fewer patients and do better care, which is really cool. I want to talk about that. The name of your practice is Floss Family Dental Center and Surgical Center. That is a mouthful. It's a big name. You've got a big vision. Tell me, you said you hinted to it a minute ago. I do some special services, as well or better than others. Talk to me about that because you've got some special niches.
Yeah, so I mean, originally when we opened the practice in 2011, I had a partner, a classmate of mine, that was doing a lot of IB sedation, that type of stuff, and that's kind of where Surgical Center came from. And then he moved on to a different town near here. We're still really good friends. He just had some family stuff, and so he kind of departed and went up to Omaha. Um, and I've been kind of by myself since then, and just trying to figure stuff out on my own, which apparently I'm not good at, and I just need a little guidance. And so that's why I absolutely rave about PDA. And I started my wife as a speech therapist and a myofunctional therapist, and probably about 2017, 2018, she had encouraged me to go see somebody out in Los Angeles, Dr. Shursagi, who's head of the Breathe Institute out there. He's a sleep ENT surgeon, and her reason for that is she was doing some myo and she was sending these kids to ENTs and they weren't getting good releases, or pediatricians were doing it, or pediatric dentists were doing it. And there's a certain way that we're trained as like tongue tie people, like people that do tongue ties, um that to be honest with you, I don't know how they're trained surgically in the medical field. I just know, like, and I can say this without a reservation, like my releases are better than theirs. Like they just are. It's like my specialty. I can't take out tonsils or adenoids. I can't take out, fully impacted wisdom teeth, and I don't want to. But so I really didn't want to work on tongues because it's a different animal than teeth and bone. It's like hard tissue, not scary. Soft tissue, blood vessels, nerves, scary. But after going to the Breathe Institute and being trained, like I just kind of fell in love with it. And the success stories that you hear from working with people with these issues, and so that's kind of how I got into it. And that was mainly adults and older kids. And then babies and infant mothers are another big part of my practice. And the closest person at the time, it was right around COVID, was up in Omaha, like for the whole state. Like people were coming from, the Panhandle to Omaha to have one of the gals there that's a friend of mine. And I actually talked to her before I went and got trained. Um, and just, like, hey, like, what's your take on this? Like, I don't want you to feel like I'm trying to horn in on your stuff, like, but I already do these. I want to learn how to do, work on babies safely. Would you be okay with that? And she's like a Disney princess. So like she's a sweetheart. And
She's probably overwhelmed if you're the only one in the entire state. You'd like to have some help.
yeah, she was. And I mean, she books out quite a ways still. But yeah, she's fantastic. And so I went and got trained with Richard Baxter down in Birmingham, Alabama, and that's the tongue tie. He wrote the tongue tie book. And I was already doing them with a laser, and I just hadn't worked on anything as young as an infant before. And so really I just needed to know how to wrangle a baby without hurting them when you're doing surgery. I mean, obviously I had kids of my own at the time, but so it just, fast forward to today, like, I do a lot of tongue tie releases for kids to adults from my wife's office, from other practitioners, like chiropractors are sending people my way. And then of course, I have parents coming from all over. And rising tide lifts all boats. Like that was one of, Bruce's big things. Like we don't need to be, protective and nasty about stuff. Like I've helped several people get started doing tongue ties and like, hey, this is what I did. Do you want my treatment planning sheets, or my symptom sheets? I'll give them to you. Because the guys that taught me gave me those things, and they all went out and got trained. And they'll send me stuff they don't want to do. That's just a little more risque than they're comfortable with. And if I have somebody call and they're just like, "Hey, we're out in North Platte," I'll say, "Hey, I'd love to see you. We can get you." I usually bump somebody's occlusal filling if they need to get in for a tongue tie, especially for a baby. Nobody wants to get a filling done anyway. But I'll tell them, "Hey, there's a great dentist in Hastings. There's a great dentist in Grand Island. There's a great dentist in Kearney that do these things depending on the age, because all those other practitioners have kind of their niche. But I'm upfront, like I wouldn't want to drive all the way across the state with an infant, like especially after surgery. Um, what I what I found though, which is very gratifying, is a lot of times those parents will drive. Like they've already checked me out, they've done their recon, like they're like, no, like I'm comfortable, like I'm uncomfortable with this in general, but I'm comfortable with you. So I'm gonna come see you. And we don't care if we have to drive. And I'm just like, okay, I will take good care of you. So between
God, I have to say that, you just so epitomize what a productive dentist is. You're compassionate for the parents. You went above and beyond to get training to figure out how to wrangle babies, before you did it. This has to be the ultimate in preventative care. Like, you're preventing so many ADHD, sleep apnea, da 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 da, airway issues and eating issues and nutrition and all of that for a lifetime. And and it's just so comprehensive. You're not stopping at the teeth. We have quite a few doctors that are embracing tongue tie and laser, and I think it's just one of the one, it will attract patients to your door like crazy because moms are the decision maker for the family. You just took you just took care of my child from birth, you know? We're not going anywhere else, and of course, my husband's coming here, and of course, his friends are coming here, so it really is a snowball effect. I wanna ask you a question. You brought up another marketing piece earlier, and I wonder if we've explored this. You said most of the people that I see are on anxiety meds and things like that, depressive meds, and they're breaking their teeth left and right. Do you advertise to anxious patients? Are you optimized for if you're taking these medications, your dentistry could be in jeopardy?
not specifically, no. I mean, in terms of, yeah, that's a really good idea, Victoria.
Yeah, not to Kate.
Uh,
To
uh,
Kate.
we're just being gentle, friendly, but no, not specifically.
Yeah,
Uh,
they could optimize your website for that.
yeah,
Like
and I just want to say one quick thing, because I
yeah,
do have quite a few people that don't appreciate like what I do in terms of tongue ties, which is fine. Like they're, different providers and different specialties. It's mostly because they don't get it, and then there might be some ego stuff in there, but you know, you can really help any age with a tongue tie release and myofunctional therapy, which is really important. Get rid of ADHD like symptoms. What I always tell parents is like, look, if I do a tongue tie release and your kid is cured of ADHD, they didn't have ADHD. They had poor sleep. And poor sleep kids are crazy. And like we drag when we're tired. And so I make it I make it a point to be like, hey, I'm not out here fixing all these things. It's just you didn't really have some of those things, and some people do. Some people have big adenoids, big tonsils, and tongue tie and um, myofunctional therapy aren't gonna fix that if they have grade 4 tonsils and huge adenoids. Um, but that's part of the comprehensive care. We take a CDCT, and we'll let the patients know. So I just wanted to throw that disclaimer in there. I don't want anybody yelling at me after today, so
I appreciate that too. I wish I still had this. I think, oh gosh, Bruce and I hosted like one of the first sleep apnea conferences that brought
Yep.
multiple people in. I'm going to say we were circa 2008, something like that, like way back in the day. And he had a slide up of, um, if you have sleep apnea, here are the 42 things that you could be diagnosed with, but they're going to give you all of these medications for this stuff, but really you can't breathe. And he went through this whole lit. I loved it when Bruce would get passionate about something because then he would tunnel vision on it, research it, and then come back and go, all they really needed was vitamin C. They didn't need 16 different drugs, right? And that's our healthcare system. So thank you for being that as well. And I know you've taken some heat about that. And I'm really also proud of you that you took a proactive stance. You've now put on frequently asked questions and and you believe like we do, education is your best marketing. So let's educate the patients, let's educate the profession because there is a huge gap medically and dentally about what is legally accepted as a standard of care. Right?
Mhm.
It is at the minimum bar so we don't all get sued and you don't have patient liability. But between the minimum, which I have to go off camera, it's way down here,
Mhm.
and ideal, there's a whole rainbow of of opportunity and things that you can do, and so, um, you really do I'm gonna have you back because there's so much. I only got to ask you 2 questions, and there's, like, 15 more. I wanna explore how you delegate, how your leadership shifted, how you've empowered your office manager, so will you come back and, be my guest again?
Anytime, Victoria. I'm happy to do it. I appreciate everything that you guys have helped me with, and you've really changed my practice, my life, everything. It all kind of stems from that. So appreciate you guys.
Oh, we appreciate you too. And again, if you're feeling alone, if you're struggling, take it to heart. Justin, I just can't tell you how proud I am. I just want to reflect back that when you're in a trough and more money is going out than coming in, it takes courage to pull out of your savings or get a loan or do whatever you do and kind of roll the dice and try something new. And I'm so glad that you did because your patients deserve you, dentistry deserves you. You're a great mentor, you're a great clinician. And I'm so happy about the way you've turned things around for your patients, your practice, and your family.
Thank you so much. I appreciate that.
All right, this is a wrap for investment grade practice. Our mission here is to help you become even more compassionate, preventative, and comprehensive in everything that you do with your patients, with your business, with yourself. I look forward to seeing you again on the next episode.
Thank you for tuning in to this episode of Investment Grade Practices Podcast. If you find value in this episode, help us spread the word by passing it along to a dental friend, subscribe, and give us a like on iTunes or Spotify. Learn more about building your investment grade practice at productivedentist.com today.